Hello, I'm Leanne Giroux, Senior Editor for Hospitals and Health Networks. I'm reporting today from the 2013 VHA Navigating to Excellence Forum in Las Vegas. Last year, H&HN and VHA launched the Fiscal Fitness Series that looks at ways organizations can cut costs while also improving quality of care. I'm joined today with Ann Alford, Director of Quality and Performance Improvement at St. Dominic's Hospital in Jackson, Mississippi. Welcome, Joanne. How has your organization's participation in the Hospital Engagement Network Partnership for Patients assisted your quality improvement and process improvement efforts?
Participation in the VHA HEN, or Hospital Engagement Network, has really provided us with some additional tools to add to our performance improvement toolbox. We learned how to use the contextualist approach, which is a different approach, totally not your traditional performance improvement approach. And it has helped us to uncover information that we may not have known about or used with our traditional PI methods. For example, in our initial project, which was a falls reduction project, we used qualitative analysis and observation. And without those, I think we would probably not have uncovered some of the information that we learned about the alarms on our beds. We learned that they were actually not working some of the time. We uncovered that through interviews with our nursing staff and our aides on those nursing units. In addition to that new approach, we also were able to network with other hospitals and also able to communicate with VHA on a regular basis. It's very helpful to be able to get information from other hospitals who have already experienced what you're experiencing, and you're able to not have to reinvent the wheel, but can use some of the tools that they have already created. In addition, we had regularly scheduled calls with VHA, which really held us accountable. You know, in our environment, we are so busy with so many things every day that it's easy to get distracted, from the projects that we're working on. Having those regular meetings really kept us focused and, like I said, accountable.
Your organization is charged with reducing hospital-acquired infections by 40% by year end. Where are you in relation to that goal, and what have you learned along the way?
I think we're off to a good start. Our first project, as I said, was a falls reduction project, and we have been able to reduce the number of patient falls with injuries by about 42% already, and we're still working on that. We just have started another project, another HEN project with VHA on pressure ulcers, and we are looking forward to a good outcome with that. In addition to that, we are considering doing a HEN project with VHA on catheter-associated urinary tract infections. We've been working on this for a while already, but we had a couple of our infection preventionists who just went to the Rapid Adoption Network training, and they really were impressed with some of the methods that we could use that they had not been using thus far. So we plan to probably participate with that. We haven't totally decided yet, but we think that really would give us some extra knowledge that we need for that project. The lessons learned, I think, are really not so much lessons learned as really lessons reiterated. One thing is that you really can learn from people who have already been there, done that, who have perfected processes and are the best in practice. So having the ability to be able to network with them, get the information and the knowledge and the tools that they've used has really been helpful. The other thing is you really have to be able to engage everyone in your organization who's involved in a process in order to facilitate improvement. You can't just engage the administrative staff. You really have to engage the people who are actually in the day-to-day processes in order to really show improvement.
How are you demonstrating the value of your initiatives?
I think it's all about the patient. If we have prevented or can prevent one patient fall, one catheter-associated urinary tract infection, one pressure ulcer, then I think that shows the value of the project. It's really inherent to, my profession, to quality improvement efforts or people to think about the numbers. But it's really not all about the numbers. It's about patients and how we affect their lives. And that comes down to what we do or don't do right for them in the hospital.
Thank you, Joanne.
Thank you for having me.